Hi, welcome back to Tuesdays with Timeless. I'm Dr. Stefanie Christian. Last week, I talked about managing and undoing sun damage. And I had several people this past week ask me if I would go into more detail talking about the brown spots that come from sun damage. So that's what this week's talk is about. Brown spots due to sun damage are called solar lentigines, although in everyday language they have a number of different names. They can be called sunspots or liver spots or age spots. But in medical terminology, they're called solar lentigines, and there's that name, solar, at the beginning because they're caused by the sun. 90% of Caucasians over the age of 60 have them, so they're pretty prevalent. And we'll talk about how you get them and what the means are that we treat them. In appearance, they're flat. They're usually round or oval, but they have sort of a moth-eaten edge. They range from light beige to dark brown. They can be as small as an eraser head or as large as a half an inch, but they can also cluster together so they seem bigger. They tend to appear on the parts of the body that have sun exposure. So the face, the chest, the shoulders, the back, and the hands. They are caused by unprotected exposure to UVA rays. And remember, we've talked about this before. The UVA rays are the ones that cause premature aging. So how do they develop? Well, melanin is the pigment in the skin. Melanin is made by and lives in melanocytes. Cyte means cell, melanin is pigment, so melanocyte is a pigment-containing cell. And melanocytes live in the epidermis, which is the layer of the skin that you can see. With repetitive damage from ultraviolet A rays, melanocytes proliferate. So you get more and more and more melanocytes. And that results in the accumulation of melanin in the skin cells, and hence brown spots. So pretty straightforward. Now, how do we treat that? Well, prior to the age of light-based devices, we used creams, and we called them fading creams, but they're really not bleaching agents. Most of them are actually creams that suppress melanocytes. So the most common one is hydroquinone, but we also have kojic acid and azelaic acid. But it's important to remember that these only work as long as you're using them, because they're not getting rid of those damaged cells that are producing all of that pigment. They're just suppressing the production of the pigment. So as soon as you stop using them, those damaged cells are going to resume making all of that pigment. They're just factories waiting to be reopened. We also have peels that work, and they have increased turnover of the cells on the top, and so you get rid of some of that pigment at the very surface. But if you don't continue with the peels, you will resume making all of that pigment, and they'll be right back. So how do we get rid of that layer of damaged melanocytes? We have IPL, which is a technology. It's been around for a long time, but now it has a bunch of new names. There are some companies that call it BBL. IPL stands for intense pulsed light. BBL stands for broadband light, and some people call it photofacial. But those are just new names for an old standard which works. So how does this work? Well, this is a light-based treatment in the visible spectrum, and the light targets the melanin in these damaged melanocytes in these pigmented lesions. But you don't just have the damaged melanocytes in these pigmented lesions, because you didn't damage your skin in spots. When we, in my age group, which is almost 60, we didn't have sunscreen when we were in our preteens and our teens and our early 20s. So we did terrible things. We did baby oil with iodine and had album covers with aluminum foil. And what we had to put on our skin was actually tanning oil, tanning lotion, and tanning butter. So we did some pretty awful things to our skin. And once we had sunscreen, not everyone used it. And certainly not everyone was taught to use it correctly. So people got damage to their whole face, their chest, their shoulders, their back, their hands, not in spots. So we actually have damaged melanocytes everywhere. So the treatment needs to be done everywhere. So what this light does is it goes in and it targets those damaged melanocytes. And when the light hits the melanin in those damaged melanocytes, the light converted to heat. And it causes a mild thermal injury. And the body recognizes that mild thermal injury and it says, oh, you're damaged cells. And the healing process in the body is kicked in and it pushes those damaged cells up through the epidermis, and then they microscopically flake off. It's a heat-based process, so it's uncomfortable. And in our practice, there's no reason to be uncomfortable. We have technology to avoid that. So we have patients numb beforehand. It requires a series of treatments, and they should be at least 3 weeks apart to get the best effect. And you're going to be spotty, especially after the first one. The spots are going to look sort of like coffee grounds as those cells come up to the surface. It gets darker and darker, and then right before they flake off, they stop being brown and they get sort of a sooty color. That's how you know the next time you look, that spot is going to be gone and you're going to have normal pigment underneath. So normally we tell people don't do this right before a wedding or a reunion or an important event. That's why this is a particularly great time to have this done, because we're not doing a lot of those kind of events right now. So, how do we prevent this? Sunscreen, sunscreen, sunscreen. And it's got to be a sunscreen that protects you against UVA. UVA rays are present from dawn until dusk, 365 days of the year, and they're equally strong all 365 days. And they penetrate ozone, clouds, and glass. So they will penetrate the windows in your car, the windows at work, the windows at home, even on a cloudy day. That's really different from the way a lot of us were taught how to use sunscreens. So it's a new paradigm. You need to be using a sunscreen that protects you against both UVA and UVB rays, so a zinc-based sunscreen, and you need to put it on every day of every week, of every month, of every year. So that's it. I hope this helps. If you have any questions, please comment below. Have a wonderful week. Stay well, and I'll talk to you next week.